Tinnitus is the perception of sound when no external noise is present. Imagine a ringing, buzzing, hissing, or roaring in your ears, even when everything around you is quiet. That's tinnitus. It's like a phantom noise that only you can hear. This phantom noise can be intermittent or constant, and its volume can range from a soft whisper to a deafening roar. Tinnitus isn't actually a disease but a symptom of an underlying condition. While it's often associated with hearing loss, tinnitus can also be caused by other factors like ear infections, head injuries, and even certain medications. The experience can be frustrating and even debilitating for some, affecting their concentration, sleep, and overall quality of life. Tinnitus can arise from various sources, some of the most prevalent being exposure to loud noises, ear infections, and age-related hearing loss. Think about attending a loud concert or listening to music through headphones at high volume. These activities can damage the delicate hair cells in your inner ear responsible for transmitting sound signals to the brain. Ear infections, another common culprit, can cause inflammation and fluid buildup in the middle ear, interfering with sound transmission and potentially leading to tinnitus. As we age, the auditory system naturally undergoes wear and tear, and age-related hearing loss is often accompanied by tinnitus. While tinnitus can be incredibly bothersome, there are several strategies you can employ to manage and potentially reduce its impact on your life. One such approach is to minimize your exposure to loud noises. If you work in a noisy environment, wear earplugs or earmuffs to protect your hearing. When listening to music or watching television, keep the volume at a moderate level. Another helpful technique is to introduce background noise to mask the sound of tinnitus. White noise machines, fans, or even soft music can provide a soothing auditory backdrop that helps drown out the ringing in your ears. Many individuals find solace in mindfulness exercises like meditation and deep breathing. These practices can help you focus your attention away from the tinnitus and reduce stress levels, which can exacerbate the perception of tinnitus. If you're struggling to manage tinnitus on your own, it's essential to consult a healthcare professional. They can help determine the underlying cause of your tinnitus and recommend appropriate treatment options. In some cases, tinnitus may be a symptom of a treatable condition, such as an ear infection or thyroid disorder. Addressing the underlying condition can often resolve tinnitus. If your tinnitus is related to hearing loss, your doctor may recommend hearing aids to amplify sound and make the tinnitus less noticeable. Certain medications, such as antidepressants or anti-anxiety drugs, have been found to alleviate tinnitus in some individuals. Lifestyle changes can also play a role in managing tinnitus. Reducing your intake of caffeine, alcohol, and nicotine can be beneficial, as these substances